Good evening. How are you?
How are you?
I'm good. Can you hear me?
I can, yeah,
Okay.
I can hear you.
'Cause I don't have my
I
tripod
can hear
today.
you.
So,
Oh
so I'm like, if I
God,
sit the phone on something, is it gonna be covering the microphone?
nah, you good.
Okay, my son took my apparatus.
Oh boy, he
You
telling
know how the
he's
kids,
setting the process back.
right? He was like, I didn't know you was going live. It's with me.
All right, let's get it going.
Yeah, I see the numbers climbing, so we'll give a minute. How was your week?
Nuts.
Good
Getting nuts.
Friday.
Happy Good Friday. Happy Good Friday.
I can only imagine.
Yeah, these cases are getting crazier and crazier.
All right, I see people dropping questions already. So welcome, welcome, welcome. Um, if you've been to the live before, welcome back. If you it's your first time here, I am Cola Red Bell, and we have Dr. Pierre Johnson with us tonight. So this is an opportunity. Today is Friday, so we can call it Free Game Friday. This is an opportunity for you to ask questions to a registered physician, certified, credentials, everything, and just get education on our bodies, our health. We have no topics off limits. So it's open to any question you have. You have 3 ways that you can participate in this live tonight. So I have people that submitted questions already. I'll be going to that list. If you want to drop a question, please put it in the chat bubble at the bottom of the screen that has the question mark and the bubble around it, because then that way I can go back and forth, because when it scrolls on the screen, it's hard. And then if you want to join in person, join us, then you are more than welcome to send Dr. Johnson a request and you could be part of the live. So,
All of the
uh,
above.
say that
I
again.
said all of the above.
Right. And I think we will have Danielle here later,
You
because
talk
a
to her?
lot of people submitted questions for her.
You talk to
And
her?
yeah, I
Okay.
did. Well, not today,
All right.
but yesterday I
You
did.
got it.
So we'll see.
I forgot to text her. You got
We'll see. I'll be messaging her while
Yeah,
we talk. While we,
she worse than you when you first started. Way
man,
worse
oh,
than
she
you.
said she
Oh,
here.
she go, oh
Oh,
Lord. Now you gotta get her in.
right, right. So some people sent questions, and they ones that you could or her could answer. But since she here, we
Look at
might
that.
as well let her. So we'll start with submitted stuff, and we'll start with
Wait a minute.
uh,
Oh no,
and then we'll
she
go back
hasn't
and forth in
she
the chat.
hasn't but
It, you said somebody's requested you already.
no, she hasn't yet. I mean I could request her.
Okay, I thought you said somebody requested you already. All right.
Somebody did request. Somebody did. I can put them on here.
Okay, well, it's up to you, because I
It's up to
got
you,
every.
but all right, you want it? What you? It's up to you.
All right,
You run it.
let me do one submitted, and then we'll go to the person, and then we'll go to the chat bubble. We'll do it in that order.
All right. Sounds like
Um,
a plan.
what are your thoughts on taking probiotics? How do you ascertain if you need one, and how would you choose one? And is that specifically important for women?
My thoughts on probiotics is pretty indifferent. Um, Meaning I don't have a stake in the game either way. Um, you know, it doesn't do harm, but I think that the good that it could possibly do is inflated. Like I tell you guys all the time, this is a capitalistic society. So when there's an opportunity to make money, people make money, and you can put a bunch of buzzwords around a lot of different things and say that they do so many different things, and you can make a lot of money off of it. So uh, I'm not saying that there aren't any um, benefits of probiotics, but I don't think that it's something that it's a must have, if you will. Like people are to the point now where probiotics are like, you know, Tylenol or like, you know, multivitamins or, you know, or just eating. You know, it's like I can't function without their probiotics. And that's kind of really exactly where they want you to be from, you know, a capitalistic standpoint. So, you know, if you take it and you see benefit to it, then great. I'm not against it, but if you don't want to take it and you haven't taken them, you know, and you're not having problems, I don't necessarily see why you need to. So, like I said, I don't down it, but I don't endorse it either.
All right. You still got a request for somebody to join?
Let me see if she's still on here. Yeah,
All right.
I'll put her on here.
Oh, did I touch something? I'm
Hello,
sorry.
hello.
Did I do something wrong?
You didn't do anything wrong. You wanted to come ask a question. How are you?
I'm fine. Oh, I'm here in the hospital visiting my son.
All right. How
I
how
I touched.
how can we
I
help
touch?
you?
I didn't touch anything. I wasn't asking a
You
question. I don't know what
weren't
happened.
like it put it on here like you wanted, like you requested to be on to ask a question. If you don't, we could log you off if you're okay.
No, I didn't.
You
I
did.
probably touched.
We put you on.
No.
Yeah, you that you did one of the colas and just tried to push the buttons. Yeah, I got you. I got you. Don't
Oh,
worry
no,
about it.
no, the
I'm
feeling.
sorry. I'm not a phone. I don't know nothing
Don't worry
about the
about it.
phone. I'm sorry.
We'll put you back out. You can just continue to watch. We won't put you on blast, okay?
All
Well,
All
right.
right.
thanks for watching
Nice
anyway.
seeing you. Okay, bye. I don't know what.
She like, shit, what the?
What I press? Hilarious. All
Somebody,
right.
I think this woman got on here before, and I'll put her on here. Hold
Okay.
on a second. Hello.
Hello. Hello, Dr. P. How are you
How?
this evening?
I'm excellent. How are you?
I'm doing good. I'm doing much better, but I was just wanting to get some information. I think I probably asked you this before the last time, as far as like with the doctor that I was seeing
Hmm.
and their means of not communicating. And so I went and got another doctor, and so far I've been doing much better,
Okay.
but they still saying the same thing as far as like with the hysterectomy, which I'm trying to avoid.
What? So kind of refresh me on your story because I think you told us, but I don't remember.
Yes, sir. I have fibroids. I had
My
myectomy.
myomectomies. Uh-huh.
Yes, I had one last year,
Okay.
and they said they removed some fibroids the size of mangoes,
Okay.
and he said he left the ones that he couldn't get,
Yeah.
which I listened to you. I don't know why he didn't remove all of them. And so that what got me worried because I was still having the same problems.
Got
But
it.
now I have a new doctor. So far, they seem like they're pretty knowledgeable. They got the MD behind their name. So,
That don't mean a lot always. So I can't even vouch for that
you're
one.
right.
That's
You're absolutely right. And
uh,
so I'm still pretty much having the same little issues with the pain below the belly button.
sure.
And they want to remove the fibroids and remove everything.
Okay. If you don't mind me asking, how old are you?
57.
Okay.
I'll be
And so
50
what
this year.
got you? So what symptoms or what issues are you having?
Like pain in the bottom here, below my belly button, and
Okay.
sometimes it's really hard for me to get out the bed.
Okay. And is that all the time?
Um, Pretty much.
Got you. Are you still having bleeding?
No, sir.
No. And so did one of those doctors, did they do an exam and try to reproduce your pain, meaning that if they pushed on your uterus, it was like that hurts when you do that?
Yes. And
They were.
they
Okay.
also did a vaginal ultrasound. And
Okay.
that's when they found the fibroids.
So when you feel your belly, where do you feel hard at? Does it feel hard above your belly button, or is that hardness below your belly button?
It's below.
Okay. Is it far below your belly
No,
button?
sir.
It's like right there?
Mhm.
Got it. And so your aversion, so what are they offering to you? What are they saying?
They said, well, we can schedule the surgery to remove the fibroids that they see on the ultrasound and do a hysterectomy.
Okay. So what's your concern?
Um, it's probably,
Better
I'm
yet, let
dealing
me
with
ask
flashes.
you this. Let
Yes,
me
sir.
ask you this. This is a better question
It's coming.
that I typically ask, like all my consults and every patient. What is your goal?
My goal is to continue living without the pain
Got it.
and just try to move forward and just be happy.
Okay. So two possible goals that you can have.
Yes, sir.
Either A, you're trying to eliminate this pain from your uterus, or B, you trying to give every chance you got at trying to have a baby at 57. Which one you trying to do?
Just get rid of this pain.
Got it.
No babies.
Got you.
Because I'll be
So,
on top of the examiner.
got you. So, with that being said, if your number one objective is to get rid of the pain and they've done a comprehensive exam and they've determined that your pain, whether it be from a degenerating fibroid or something in your uterus is causing you to have pain, then you have multitudes of different options. But with all that being said, a hysterectomy has to be on the table,
Okay.
right? And it should be considered on the table because you made it very clear what your objective is, and the only way that you can 100% be guaranteed that your objective is accomplished is remove the thing that's causing you to have issues. So you can go treat those fibroids, you can remove those fibroids, but as long as you have a uterus, you have a potential for problems.
Okay.
So with that being said, then it comes to the point of how did they propose or how did they give you the option of performing your hysterectomy? What did they say?
That's the thing. They didn't go into that. They just
Hmm.
put the surgery on the table, but didn't go into deep details. And with me, I normally would write questions down
Hmm.
before I go to the doctor's office, and that time I didn't do. And all I'm thinking about is what's going on at that moment. And
So
that's
with that being said, the number one option for you would be to perform a laparoscopic or minimally invasive hysterectomy, right?
okay.
That's where if someone is not offering you that option, then I would definitely, kind of run for the hills, if you will. They should be able to offer you a minimally invasive approach, hysterectomy, if that's so what you desire. To do this, you should be out of the hospital in a day or less, and you should be able to be back to work and recovery and the normal things you do within 1 to 2 weeks. You know,
Okay.
so given everything that you're telling me, that's what it sounds like would make the best decision, but it's not the only decision. I would really have to examine you to make sure myself that your pain is really secondary to those fibroids into your uterus, because other things can cause you to have pelvic pain, not just um, your fibroids. You can also have, things going on with your bowels, irritable bowel syndrome, ulcerative colitis, gluten intolerance, or you can have all types of things that can cause you to have other types of pain. But it's very uh, it's imperative that they really pinpoint what is causing you to have pain. And if it truly is that, if it's truly your uterus, then hysterectomy should be on the table at this point. But with that said, it should be from a minimally invasive perspective. Like nobody should be cutting your belly from hip to hip or from your privates to your chest trying to take that out. Should be small incisions to be able to remove that and let you get on about your way in your business and be completely healed and not have to worry about anything else.
Okay. And one question, and that's gonna be it for me today.
No
So you
problem.
can, I guess you can see as far as like, and I have on a big shirt,
I
but you
see.
can see how.
Now, let's talk about this. So, we have to ask is all of that is fibroids, right? Because if it's not hard up there, that ain't fibroids. That's soft. That's soft. That's soft. So removing those fibroids not gonna give you a six pack, mama. We gotta talk about what we put on the kitchen table and how we cooking. Now
Okay.
the hard part up under that belly, up under the belly button, absolutely we can take care of that for sure, 1,000%. But the biggest misconception I see is, well, when these fibroids come out, I'm gonna be ready. It's gonna be six pack bikini time. What? No. Now, if you been eating that fried chicken or eating, and eating all that stuff you want to eat, it ain't going away with them fibroids. Now let's keep it 1,000.
Okay. Okay. I
All right.
got you. Okay.
But before making a decision about, whether to get a hysterectomy or not, I would definitely say, figure out exactly what you want. And if this is really that important to you and is impacting your quality of life, then you should consider it, as long as the fibroids are causing the issues. And by all circumstances, it should be done from a minimally invasive standpoint. You should not be open to have a hysterectomy. So that's my advice. And if they don't, you call me and let me know. That's what I'm here for.
Believe me, I'm going to call you because I had spoke with my primary care and I had told him that I had been listening to you, and he just gave me the look.
Side eye.
Yeah,
I
and
get it.
I'm like, but this is what I want, and he's knowledgeable, and he's there to help us. And he was like, "Oh, but you have plenty of doctors out
Right.
here."
But
No,
if they listen, but if they you just ask real simple, can they get me out of the hospital in a day? And can they ensure that I'm not gonna be in horrific pain in the next month or, infection and bleeding and all that stuff? Can they do that? And if the answer to that is no, then you don't need to talk no more. Like everybody talks real good. It sounds really good until you ask the right
Mhm.
questions. When you ask the right questions, then people start to shut up. You ask them, what what is your experience with large uterine masses? What is your experience with robotic surgery? How many surgeries have you converted from a laparoscopic surgery to, meaning when you put your plan to do a laparoscopic surgery, then you decide you can't do it because it's too difficult, and then you have to open the patient. How many of these cases have you had? So when you ask them questions, there's no argument. Like, or if they don't want to answer those questions, then you have your answer. Or they try to dodgeball those. Those are very, very specific questions that any competent surgeon should be able to answer. Because I don't get offended when people ask me that, because I love the answers that I'm able to give, and my answers are reproducible. I mean, you can do your research on them, right? So ask them those questions, and if they like, well, it's possible, and all that dancing, you got your answer.
okay. Okay, thank you for having me on, and greatly
Very welcome.
appreciate everything.
Absolutely, my pleasure, my pleasure, my pleasure. You take it easy. Let me know
Okay.
how I can help you. Okay.
Have a
You
good evening.
Have a
too.
great evening.
Thank you. Now you got to cut me
I,
off from your end.
I got you.
All
Get
right. There's
me up
somebody
out
else
of
in the
here.
comments That's
Yeah,
asking, can they join?
it's a couple people. Yeah, do you want to do that, or you want
Oh,
to what you want to do? You
you get.
want to get questions? You want to put somebody else on? All
Mm-hmm.
right. Okay. Damn, man. Tweaking. For real. It's like they ain't gonna put us on here. Yeah. Man, they all right. And then 30 minutes.
We had a little dance
Hilarious.
break.
They out here doing it. There's somebody else here. Hold on. That's hilarious. I got you. So,
You? Are you there?
Yes. How are
How
you?
are you? Thank
so that I'm gonna answer that next because she said she did send me a message about that. I'm gonna answer that.
Okay.
Hello, how are you?
Peace. How are you? My name is Jewel. How you
Peace
doing?
Good.
to
How are
you.
you?
Okay. So my question is on severe endo. I have stage 4. I was diagnosed at 19 years old. Now I'm 43.
Okay.
Tube to my left fallopian tube. And over the years, I haven't had the doctor do any other follow-up laparoscopies. I've changed doctors many times because they kept insisting on getting a
Sure.
hysterectomy. Just put me on endless like birth control when I was in my early 20s and things.
Hmm.
And I feel like if I would have listened, I wouldn't have had my daughter. So I had 2 miracle babies. One is 16 and one is 13.
It's a
16.
blessing. God bless you with that. That's awesome.
Yes, I'm grateful for that. So I did have a C-section with my 16-year-old,
Hmm.
and I had a VBAC home birth with my
Okay.
13-year-old. So my question now is at 43 years old, I don't intend on having more children, but I'm
Sure.
still experiencing severe pain, like pain down my legs, the back pain. I have severe clotting.
Hmm.
The fatigue is like insane. Anemia is like I'm still having all these symptoms, and now I'm experiencing like severe dry mouth. I feel like I can't breathe a lot of times, like just the
Sure.
constant like and catch my breath. So I don't know if it's like getting worse or where else the spread to, you know what I mean?
Hmm.
Because I haven't gotten to be in so long. Um, and the other fold is like I always went for black doctors
Sure.
too, because I always representation like for myself, right?
Hmm.
And always like the best care.
Hmm.
I've been getting gaslighting from medical doctors for quite some time. Even
Absolutely.
2 years old. So I had my first daughter at 26 and my second daughter at 30.
Hmm.
And after having my second daughter, it was like, well, you're not gonna have any more, right? So just go ahead and get a hysterectomy. And I'm like, oh my God, like it's never like an in between in terms of like planning for managed care, like pain management care and
Yeah.
things. So I don't know what approach to take now, because I
Sure.
get like a full workup and see what are the options because I've never gotten any surgery done.
Sure.
Um,
So you finished? I don't want to cut you off.
no, I don't know
Okay.
what other options, but I have so many symptoms. It's insane.
So I totally I get it. So you're kind of in a rare space where uh typically women with endometriosis are impacted much younger, have a element of infertility, and it's a lot more difficult. Whereas you've fortunately enough have had children, um, and you're at a point now where you should be starting to see some ovarian decline, um, to almost to where you're at the finish line of not having to deal with this with surgery or anything else. But you still have some significant ovarian hormone production still left, which is why you're having the pain and things that you're having if this is indeed endo. There are other things that could cause it, like adenomyosis, which is actually the growth of the lining and two, which I'm gonna get into that next question,
Mhm.
where when they asked about adeno, where the lining of the uterus actually grows into the muscle of the uterus. So
Mhm.
I would say, just from a comprehensive standpoint, we need to figure out exactly what's going on with you, but you don't necessarily need a huge workup. Gynecology is very simple. It can be simple, rather, where it's either one of two causes that are usually causing pain or issues. Either it's a structural cause like fibroids, polyps, and things like that, or
Mhm.
it's a hormonally regulated cause, meaning that your ovaries are producing hormones and tissues in your pelvis and in your body are responding to the hormones that the ovary is producing. With that said, if you really want to find out what it is
Mhm.
you can suppress the ovaries, right? And if your pain gets significantly better, then you have your answer. So for endometriosis, I would say the treatments and medications have gotten much better. And there are things that I would suggest to you even before going a surgical route. And one of those things is a medication well, there are two medications. They're competitors of each other. One is called Orlissa, the other one is called Myfembry. And both of them are designed for the treatment of endometriosis for
Okay.
women. Um, and that's what I would first line recommend to you, just a 3-month trial of doing that and to see how your pain is improved. One of two things can happen. Uh, One thing is that it could be, markedly improved or just minimally improved, rather, and you still have significant pain. And from that, we have other options to go down that pathway. The other thing is you could just take it and, like, hey, life is better, pain is great, and we just keep you on that medication for at least the next 2 years,
Oh,
and not have to worry about surgery. If it's at the point where it's getting better, but it's not to a point where it's livable and it's still impacting your quality of life,
it
then
does.
surgical options are available. And the first thing I would do is just what's called a diagnostic laparoscopy, meaning putting a camera through your belly button and looking.
Mhm.
And they've done that already too.
Yeah,
They've done that already.
diagnosed at 19 with a
Got
laparoscopy,
you.
stage
But
4.
they haven't done anything else since then.
They didn't remove anything at all. What happened was I
Right.
was on birth control for many years. I
Sure.
tried, it didn't help. I tried
You tried Lupron.
pain management.
So Lupron didn't help you.
No, and then I was given naproxen 800, and I was popping those like Tic Tacs, 3 or 4 of those at a time.
And you
Uh,
got pregnant after that? You got pregnant after the
yeah.
Lupron? You
So
you
then I went
wow.
of trying to deal with self care and holistic measures. So I went the raw alkaline and things, and that is as to why I was able to conceive my daughters.
Sure.
Um, I just don't necessarily. I mean, and that's what I put out in the universe. I'm not sure. I can't say that's exactly what happened, but um, and like I said, I had my first at 26 and at 30, but today at 40 is like, okay, do I go through this rigorous dieting and fasting and all this because I don't feel like that still helps with my energetic level, dealing with pain. Sometimes I can't even function at work. I feel dizzy because I'm, just kind of out of it, and I have to pause all the time, like take additional breaks, which impacts, my performance at work and things. Or so I am a lay midwife,
Sure.
a doula, and all these things. So while I'm at it and attending births and doing these things, it's exhausting because I'm away from my family. I'm
Sure.
exerting all this physical energy, and I just get too burnt out. So I've taken a lot of like herbal tinctures and all that. And that's also another form of gaslighting because folks like, oh, take your sea moss, yoni steam, boom massage, castor oil. It's been over 31 years now for me, and I've
Yeah.
done a lot of those things. So I'm by far like new to like having this experience, living with this hell for all these years. So
Mm.
I don't know how to deal with it today because it's.
So let me give you a go
I'm
ahead.
sorry.
I'm sorry. I didn't mean to break you. I didn't mean to cut you
No,
off.
the last point was just the psychological weathering. It's just like intense for me because
Tough. I
I
bet.
have to still, take care of and just live life, and I don't know how to deal with it today.
I'm gonna break down all your options in a nutshell of which way you should go, right?
Okay.
No, number one, either, and all of these really kind of depends on your tolerance,
Mhm.
right? At a certain point, man, woman, boy, girl, we all get fed up for whatever it is what we're dealing with.
Right.
Sometimes we're at a point where it's like, I'm kind of pissed off, but I can kind of weather the storm and try to see what kind of works. Other times it's like, I have had enough. I don't want to try things. I don't want to do anything. I am at a point where I am done. So all of these things are really going from here to here
Mhm.
as far as like your tolerance level,
Right.
right? Meaning the last being the most definitive thing that would make sure that everything is taken care of. First thing I would do, since it's documented that you have a very advanced stage of endometriosis, I wouldn't do things like progestins or Depo or anything like that. I would
Mhm.
go straight. The lowest I would go would be those medications that I'm telling you about, which would be um, Orlissa, Myfembree. We'll start with one of those two and to see how you do after with 3 months and then reevaluate. That's option number one. Option number two would be to actually try Lupron again. Lupron is the higher medication. I get it. I know you've been there, but these are just the options.
Mhm.
Lupron would be, the really end of the end from a medical standpoint, of a medication standpoint, to see if it could be treated without actually performing surgery on you. If it is really, really bad still through the Lupron, and bodies change, right? So the way your body responded 10 years ago, even 5 years ago, is
Mhm.
not always now. I have women that, come to me in their early 30s, having horrible bleeding and just horrible problems, and I'll say Depo to them and say, "Hey, I was on Depo when I was
Yeah.
19. It's the worst thing in the world. I never want to do it. Blah, yada yada yada." I, I convince them to get on Depo in their early 30s. The best thing that ever happened to them in their life. Your body at 19 is not your body at 30, and it's not your body at 40. So I would not eliminate treatment options just because it's been horrible for you in the past. Your body composition is different. So second option I would say will be Lupron. At least try that and all of these things are 3 months, because you can't just take them right away and expect them to work. You have to give them a few months to work first. So we want to be straight medications and give the most strongest medication you possibly can give. That will be Lupron, to try that. If we won't want to do that, then we go into surgical routes. And the first surgical route would be what's called a fulguration or peritoneal stripping of the endometrial tissue. So basically putting a camera in, putting instruments in, and then basically mapping out all of these little lesions and spots and things that are all inside of there, and start to kind of peel those away and burn them and peel them and burn them and peel them and burn them and peel them. And then once you do that, you still are going to have to either do the Lupron or the Orlissa, because at the end of the day, it's fed with hormones. Your ovaries are not going to stop until you hit menopause. You're not there yet. So, whatever you do from a surgery perspective, minus the last option, you're still going to have to suppress the ovaries at the end of the day. It's either suppress them and see how it goes, or surgery and then suppress them and see how it goes. One of those
With
two options.
endo belly too, because I have endo belly with all the inflammation and
Say,
stuff.
say it again.
Endo belly, would that impact like the level of inflammation and discomfort from having endo belly?
Endobelly, meaning
Like the bloatiness, like my stomach.
bloating. Yeah. So
Will
you're saying with the medication,
yes,
would it
I'm
interfere with the bloating or make it worse?
the inflammation in my stomach, like the way it looks and like feels.
Sure.
Sometimes it's not. It just kind of changes.
And
Um,
that can fluctuate with just the hormone production as well as just inflammation from your process that you're having. But the last but not least, if any of those things are either not working, or if you have gotten to your wits end with it and don't want to do it anymore, then it would be a hysterectomy with removal of your ovaries.
okay.
That's the last. That's the last line. I think you got your speaker like on something, so it goes in and out when you talk. That's
Sorry.
okay.
So yes. Um, so it's an entire hysterectomy, not like a partial.
Yeah. So it's just hysterectomy. So hysterectomy, removal of your uterus and your cervix, removal of your ovaries in addition to that.
Oh, and it did.
Yes. Because if I just removed or someone just removed your uterus and fallopian tubes and kept your ovaries are still going to produce hormones. Those lesions are still going to be there. You're still going to have a problem. It's just eliminating the ovaries. Now you don't necessarily need to remove the uterus. You can remove the ovaries the same way and just keep the uterus. That's still a
Oh,
possibility as well. But it's removing the source of the problem, which would be the ovaries.
the ovaries.
You know,
Okay.
so that's always an option. Doing either a hysterectomy or removal of your ovaries, or just removal of the ovaries, um, and remove the source of the hormones. But any of those options are on the table for you. It just really kind of depends on what your appetite is for, or your tolerance is for treatments that may not be give you what you want. But at the end of the day, definitively, if you did remove your ovaries, if this is bad endo, removing the ovaries is going to, eliminate that.
hmm So last question. What about painful intercourse, physical intercourse? Is that a potential fibroid issue, or is that also just like the endo?
Yeah, I'll
Because
have.
every time I mention that, and like when I'm going to get care, it's kind of like brushed over. Like, oh, you may have fibroids, but then no one's following up for me to get screening for
Yeah,
that.
I would have to do an ultrasound and examine you to make that determination.
Okay.
But you would have to have fairly large fibroids, and them being like in the lower part of your uterus for them to be that. It's probably more so, sex is causing movement and irritation in the lining of your pelvis from the endo, which I would probably say would be it. But again, I haven't seen your ultrasound or anything like that to say that. If you had a big 20 centimeter fibroid in addition to these things, then yeah, for sure it could be it. But
Okay.
if you don't have a big significant fibroid there, then this is probably pain secondary to your endo.
Okay. Thank you so
Cool.
much. Helpful. I appreciate your time and
Very
energy.
welcome. Very welcome.
You.
Let me know how I can help in the future. Okay. All right.
A lot, Pete.
All right.
Thanks for joining.
Thank you, Queen.
All right, let me go to the
Questions?
question bubble.
All right.
If you got questions, drop them in the question bubble. If you want to join and get a free consultation on the spot, request through Dr. Johnson to join the live. All right, first question. Can fibroid be removed during pregnancy? And if not, how can you manage fibroids during pregnancy?
The answer to that, quick and dirty, is no. So it's definitely not going to be removed during your pregnancy. It's a possibility if you had like a pedunculated fibroid, like a fibroid that was like stalked off your uterus, and somebody did a C-section and saw that, then yeah, you can remove that. But if that fibroid is like in here like that, no, because it's not going to happen during a C-section, because all of this has a blood supply. You worried about getting a little baby that's in here, and then you try to remove that, you got too much bleeding, you got all types of problems. You run the risk of having to get a hysterectomy or what's called a C-hyst with that. So yes, it's convenient if you had a C-section. Just go ahead and remove the fibroids too, but in practicality, it's not, because you just it's too much of a risk. It's too much of blood supply. It's just very risky to do that. Your uterus is 10 times its normal size at that point with a vigorous blood flow. So no, you do not remove them during or at the time of delivery. You wait till after, if you have to perform a myomectomy or remove fibroids after the delivery.
All right. Would you suggest a tubal repair surgery to treat a hydrosalpinx?
I would not recommend a tubal repair surgery to treat hydrosalpinx, and I'll tell you why. So back to my diagram, so what they're talking about is hydrosalpinx is when your fallopian tube is dilated because there's fluid inside of it. So that fluid can cause the tube to be dilated, and that inhibits, or it hinders, let me not say inhibits, a sperm from going in to meet the egg and the egg to come back through here and to implant into the uterus. In addition to that, it also, if you do have an implantation here, embryo is here, this fluid is what's called embryotoxic and can spill in here and kill a very early pregnancy. So hydrosalpinx is one of those things that you really don't want to play with when you're talking about fertility, or especially if you don't have a lot of time, late 30s, early 40s. Um, People, just just are in awe by that. But your fallopian tubes are very, very delicate. They're portals for sperm and egg to meet, and portals for them to come back and implant into the uterus. Once you have damage or fluid in there, is really not a lot that can be done. You can try to drain it, you can try to open it, but it also increases the risk of pregnancy loss, ectopic pregnancy. So for your money, your time, your health, it makes way more sense to remove that fallopian tube and give yourself a much better chance of pregnancy with that, and if you talk to any reproductive endocrinologist, any fertility doctor, they will tell you the same thing. If you came in there and you were looking for fertility treatments, and you had hydrosalpinx, they will recommend that you remove it. Why do they do that? Because they are one of the few professions that they get paid on their success rates. Not your desires, not what you want, not what this is, and all that other stuff. They get paid for all the people that they put on a cycle, how many of those people actually get pregnant at the end of the day? And they have to post their success rates or what have you. And so they're not going to do low yield things. They're not going to do a bunch of tubal reversals and try to put people through cycles. They're not going to do a bunch of tube saving and put people through cycles, because at the end of the day, yeah, they may make money from that, but their success rates are going to plummet. So therefore, they don't want to do that. They don't recommend doing that. Can it be possible for somebody to get a tubal reversal and get pregnant? Absolutely. Can it be possible for a possible correction or drainage of a fallopian tube to get pregnant? Absolutely. But it's also much more plausible that some type of repair or trying to salvage that tube is going to end up into an ectopic pregnancy or some type of failed pregnancy. So, I don't recommend doing that. It's not worth it. And especially if you're undergoing in vitro and you're putting, $20,000, $30,000 into something, you don't want nothing hindering that or messing that up. You want to give yourself the best opportunity to do that. It's almost like driving a car without no insurance. You don't want to drive no brand new car without insurance. You're not going, you have too much invested in that to not give yourself the best opportunity for success. So yeah, in answer to that, I would say that's not a good thing. But that's what hydrosalpinx is, and that's my recommendation from that. Let me answer that last question about the endometriosis adenomyosis again, because I want to make sure that I answer her question. So adenomyosis again is when the lining of the uterus actually starts to grow into the muscle of the uterus, and these implants can be very, very painful, and it can make bleeding worse, and it makes the uterus what's called boggy, and it's just an abnormal shape, abnormal contour. It's very, very difficult to really treat. The only definitive treatment for adenomyosis is hysterectomy. If you go in there and remove some of those adenomyotic lesions, yes, it could possibly have some improvement, but you could also do significant damage too. And it's no way to really get it all. If you have adenomyosis, it's just a very tough thing to have happen. But you kind of can deal with some of it if you're trying to preserve fertility. It's not to say that you cannot have children with adenomyosis, but it does decrease or diminish your chances. So you just really want to really evaluate where you're at with it and making a very informed decision about treatment options and really what you want. Endometriosis, the difference is the same lining. It's not growing in the muscle, but it's growing in implants inside of your belly, right? And those implants are responsive to the hormones that come from your ovaries. So it's just two different ways. It's the same type of tissue, but that tissue is implanting in different places, which for endometriosis is more easily treatable because it's strictly hormone driven and it's out more so in the atmosphere, which is your belly, as opposed to stuck deep into your muscle. So I hope that answered that question. It's like they're very complex things. There's other treatments and things for them, but that's the kind of bare bones behind the everything, what it is and what it causes, what the issues are. All right, go ahead. I'm sorry.
No. I was just gonna say we need to go to the question that somebody submitted to you.
Yeah, that was it. Yeah, that's it. So I hope I answered that for her.
Okay. Pedunculated fibroids are attached or like a stalk. Are they harder or more dangerous to remove than floaters?
All right, pause. Let me so let me clear up some stuff. Where is my DVA? I had a floater. I have not heard anybody talk about a floater. Hold on. Gotta find my thing. So,
If you have a question, drop it into the chat bubble that has the question mark in it, please.
all right. So I don't know what a floater is, but let's have some education about fibroids, right? So pedunculated fibroids, and that's an ugly picture, but those are just varying fibroids, but this is what it looks like. So a pedunculated fibroid is something that looks like this, where and I guess this is what you would call a floater, but it's not a floater. It's always attached to something. It's not just floating around in your belly. It means it's a stalk that's attached to the uterus, right? It is kind of free flowing, but it's still attached to the uterus through a stalk. Um, Myometrial fibroids are fibroids like this that are in the muscle of the uterus. They're not in the cavity, they're not outside, they're like in the muscle. So these are the three types. The last type are submucosal fibroids, or any type of fibroid that's pushing into this cavity right here. Those are submucosal. So you got three types: submucosal, myometrial, pedunculated, or serosal. Well, I'll take for it. So you could even say the serosal ones will be kind of like on the surface here. So a pedunculated technically is a subserosal. It's really on the surface or the outside of the uterus, right? So I look at it as a house. Roof, chimney, the brick mortar, drywall, and then inside where you live at, right? So there's nothing that's just floating around. Subserosal or pedunculated fibroids are my dream. I love them. They make my job easier. Usually, when I have these big cases with all of these big masses, thank God, Jesus, they are usually like this. It's just a huge mass hanging off with a stalk from the uterus, and that stalk is causing it's the blood flow to that fibroid. And usually, when I get that blood flow, that's when you see me kind of like pulling stuff out because I've been able to identify that communication, cut that communication off, cut the blood flow off, and now it is free floating, and I'm able to do what I want with it. So that's kind of like the magic behind what I do. But don't just think that it's just floating around in there. That's the difference between like the three types of fibroids. So I hope that answered the question.
All right. Anybody requesting to join before I go to another question?
Yeah, hold up. They did. Let me pop some money. There's a couple people in here. But here we go.
Hi, how you guys doing tonight?
Good. How are you?
Good and you.
Good. I had a question regarding like getting a myomectomy. I canceled it twice. They
Good.
didn't ask me for my OBC, so I was like, okay, that was a little off to me. Like how
Your ob
like I had to my
your
overall
obesity.
my overall blood count.
Okay.
Okay, so
Okay.
they like it I had to do like my own research. Like all they did was schedule me. That was it. Like they didn't
Okay.
I had to basically go to my primary care provider and ask them for like, request the MRI. Like I did a lot of legwork. So like I wanted to know like I know you, like I'm in New York and you're in Chicago, so like
Mhm.
and I have like currently right now I don't get my PPO until like I think in a couple of months when I start my new position. But right now
Okay.
I have HMO, and I know that's like gonna be a little difference out of state or whatever. So I was
Mhm.
wondering, did you have like any referrals for other doctors?
Not in New York,
No?
unfortunately. I'm sorry. Not in New York. I got about probably about 10 patients that have flown from New York for surgery. So
Really?
New York is one of the those hotbeds. Like honestly, the bigger the city, the worse it is. So New York, LA, Houston, Atlanta, Miami, those are the places that people call me the most. And they come in. Probably from each one of those, I have double digit patients that have flown in from all of those cities.
Really? Because
So
it's
if
my fiber is
I
like big. It's
and once
huge.
and that's the thing about it. Once so this it's comfort. Like, what do you do for a living?
I work for Health First. Is actually a new. I work with Medicare patients in New York, like a health insurance.
Right. So you you have in your job, you created a skill set and a comfort level with dealing with insurances. So like when people ask you questions, like you're able to answer them, you have a
Right.
comfort level. Medicine is no different, right? So
Hmm.
it's our experience and our comfort level.
Right.
When you have the reason I'm me is not just because I'm just like, I don't try to brag on myself or anything like that. It's just when it gets to a certain point, the comfort and the skill level diminishes. So people are not comfortable with dealing with big masses because they just don't do it. It's too much of a risk associated with it. And if you don't have that in your experience in your repertoire that you've like seen this routinely, you're not going to really deal with it too much. It's going to either be a vertical incision and most likely a hysterectomy. So it's just more so of a comfort level and a skill set from that. And if I had somebody out there, I would definitely send them to you. But people know what I do. And so I look for, I'm not gonna go find them. I
Right.
would look for people to say, hey, do you know Dr. P or whatever? And they would be like, hey, why are all these people going there? And I'm here. And then for them to reach out to me and say, hey, I'm here. Like people don't have to fly out there to come, to come see you. Like send them to me. And I
Right.
would gladly do that. I'm not a person to say, hey, I want you to fly out to Chicago. I'm just here to help. So
Right.
if you don't have the options, I'm making myself available to you. But I don't have nobody from New York doing that.
Stop.
So it's like, so
Well,
I,
I'm gonna try my best to get out there for sure. It's like I don't have like I see a lot of people with like like pain, and I know people who like done the fibroids, but I'm not like I'm 36. I'm not trying to go multiple times to have multiple surgeries. I don't have
sure.
children. I don't want the option to like not have children if I guess if I want children. But I don't want to go back multiple times. Um,
Agree.
I hemorrhage a lot. Um
Hmm.
like maybe 3 days straight. I'm not in much pain, but I feel like my breathing, I feel like it has something to do with my breathing. And I go like, I want to say every few months to get like injections for anemia, the
How
infusion.
big? How big? Where you feel hard at on your belly? You don't have to pull your shirt up, but stand up on me and show me where you feel hard at on your belly.
Um, it's well, I'm gonna have to stand up. Wait, hold on. I
Go
can't
ahead.
actually. Well, I have on little shorts. I kind of don't want to stand up.
All right, all right. I won't put you out there like that. I'm sorry. So
so
let me ask you this. Let me ask you
so
this.
it's
Is it
big.
above your is it above your belly button?
It's on both sides. I feel it hard. Like it makes I don't know if this sounds weird to you, but during my period I have a stomach,
Yeah.
but when I don't have a period, my stomach don't look that big. If that makes sense.
So
It's like it
well, it might not be
protrudes.
that big.
It's like
So
it
if it's big,
protrudes.
so to me, big is period, no period, happy days, birthdays, whatever, it don't matter. Your belly is big. Like when Cola came in, like her belly, it don't matter where she was at, her belly was like
But
pregnancy belly
When I was on my
because
cycle,
it got
it
bigger.
did. You
But
probably
Yeah,
don't
even
know
when she was off
that.
her cycle, it's not going to. You say stop playing
like
with you.
it protrudes. Like it's almost like when you eat food. Like say if I didn't have fibroids, you know how you just full and you
Yeah.
like kind of bloated. So it makes me look as if
Oh,
I'm pregnant when
yeah.
I'm on my period. But when I'm off
Do
my
you
period, it doesn't look like that.
when you press on your belly,
hmm
where is it hard? Where do you
Um,
feel hard at on your belly?
I don't know if you.
Is it above
It's
your
right
belly button?
here,
Where's your belly button
right
as
here.
in relationship to your
My
belly?
belly, my
Right
belly
there.
button
Your
is right
belly
here.
button is there. And then where's it hard at? Right above it?
Heart right here.
Yeah.
The whole thing right here.
It's big. So you got like a
They said it's
24, 26 week size
okay.
uterus.
Yeah, they said it's like 20 weeks. Like if I'm 20 weeks
If it's
pregnant.
anything above the belly button is bigger than 20 weeks. 20 weeks is your belly button.
Okay, so that's what they told me.
Yeah.
My uterus is enlarged like a 20 week pregnant woman, and one of my biggest fibroids is 10 centimeters.
So big but not horrible. But
You said say it again.
10
I'm sorry.
centimeters is 10 big but not horrible. 10 centimeters is like this. That's 10 centimeters.
Can I be a little candid?
That's why we here. Yeah,
Okay,
absolutely.
so
Please do.
even like during my like menstrual,
Yeah,
like even my
yeah.
vagina hurts.
I bet.
Like it's like all of it like that. Like it feel like a lot of pressure. So that's what I feel, a lot of pressure, and not necessarily like pain, like I'm in pain, but it's just like an uncomfortable feeling.
Let
And
me ask you. Let me ask you a personal question.
mhm.
Do you have pain with sex?
um when I was doing that, no, I didn't.
Yeah. So that I'm asking you that because that kind of tells me location wise. Is it on the lower part of your uterus? Is it up? So if you're not really having a lot of pain with sex, it's probably not lower uterine segment, it's upper.
hmm
So with that being said, it it's I hate saying this because it's just a mean and bad thing to say, but you kind of get what you pay for, honestly. And it's like I hate that I see it all the time. I see women go through myomectomies. I see women go through stuff and get told different things, and then by the time they get to me, bad things have happened. So
Right.
a couple of different things. If you're looking for somebody, like I said, I would ask a couple of very specific questions. Number one, ask, what is your approach to large fibroids? Ha- right? So if they say vertical incision, or if they say, well, what you have, they're gonna cut you like up from your privates to your belly button. I would not go with that person. Right?
So if they
At the
say
very,
vertical, and you said if they say vertical incisions, right?
yes,
Okay, so I'm sorry, I'm writing it
they should
down
not.
on my
Yeah,
other phone.
don't. You should not. What you have should not be a vertical incision. You should not have a vertical incision at all.
Okay, no vertical incisions.
Because you young and fly, right? You don't want to walk around like in your bikini and have to put a one piece on because you got a big cut on your belly, right?
I mean, if I have to, I will, but like, I mean,
You
that's
don't have
not
to. I'm
right.
telling you, you don't have to.
You don't have.
You don't have to. I'm telling you out of my mouth, you don't have to do that. So that's number one. So ask them their approach to it. Ask them like, what is your philosophy on removing the fibroids? If they say, oh, we remove the ones that are probably problematic, and we leave the other ones or whatever, I would not go with that person because the chances of you having to do this again are extremely high. The other thing I would ask would be, what is your conversion rate? Meaning, like, how many times have you performed a myomectomy and had to perform a hysterectomy because of complications? If that
Okay.
answer is multitudes of times, then I would not go to that
Wait,
person.
do you mind repeating that one more time? I'm sorry, because I'm
Sure. I would
recording it.
ask, how many times have you had to convert a myomectomy into a hysterectomy?
A myomectomy
And if
into a hysterectomy.
And if that answer is multiple times, or if they get upset at that, or if they are kind of flaky about that answer,
Mhm.
I would not go with those persons. All three of those, the answer to all, and then I would ask, what is your experience with fibroid surgery? They say, hey, I just finished residency last year. I would have a problem with that. Or hey, like
Okay.
usually I will go to about 20 weeks, and then after that I would refer out to a GYN oncologist. I would have a problem with that. So
Okay.
these are four major questions, and that's for anybody. That's why I do this. It's about education. Four major questions that I would ask any surgeon about any female surgery, um, what their approach is, and they should be able to be very comfortable with answering those questions. They shouldn't get mad, they shouldn't get upset. They should answer those very, very straightforward to you without a problem. And if you get any pushback to it, I will run out the door.
Okay. And how long should like the procedure be? Like, I want to know that
Now
too. Because they told me
that
two
part is
days, but I'll be
they're
six.
2 days.
They told
2 days to
me
do the
like
surgery.
in a hospital. They said like
Oh,
I'll be
okay.
like, but
Well,
they said my recovery will be 6 to 8 weeks.
all right. So from a surgery perspective, I don't know how long your surgery would actually take. It just depends on the doctor. For me personally, I remove every single fibroid. Every single fibroid you have, I am going to be in there and remove it. Now, for everybody's listening, I know y'all hear me say that. I swear to God, I'm not going to be up here till I'm 60 doing it. Like, I have the energy to help Black women right now, which is what I'm doing. Y'all coming in here with 50, 60, 70, 80, 90, 100 fibroids, and I'm in there 5, 6 hours pulling out all of these fibroids. I don't get nothing extra for that. I'm committed to doing it, right? But it is taxing on me to do it. Um, so don't be like, oh, Dr. P gonna be here for 10 years. I'm just gonna let it grow and grow and grow and hit. No, he's not. At a certain point, I'm not. But to that point, I can't tell you how long your surgery is going to be because I wouldn't know what the extensiveness of your fibroids are. Sometimes the fibroids are on the surface and they're not that bad. Other times they are all riddled throughout your uterus.
Yeah, I think
I'm
mine
gonna
is
post
all
something.
over.
I'm gonna post something this week with my toughest case, not my biggest case, but like one of my toughest cases that I had like last week, to where her uterus was destroyed from fibroids. I've never seen a uterus have that much damage full of fibroids, and it took me so long because I promised her that I was going to preserve her uterus, and I just had to. It was like a complete facelift after I took out all the stuff. But
Oh
to
wow.
that point, I don't know if it's going to look like that. So from a standpoint of how long surgery is going to be, I don't know. As far as the recovery is concerned, it doesn't really matter. All my patients, like from myomectomies, either a majority of them are in the hospital for 2 days, some of them out in a day. It just really kind of depends on how extensive surgery is. From a recovery standpoint, the reason I do it with small incisions and very low is because
Mhm.
I want you to recover quicker. I want you to not be in significant pain. So usually my patients are able to do their normal thing within about 2 weeks. Normal activities and stuff in about
Oh,
2 weeks. Now, when you
that's
ask
great.
like healing, total healing time, that's different. The total time for that scar to heal is going to be like 9 months. The total
Okay, that's
time
fine.
the total time for you to be able to get pregnant is 6 months. The total time for you to be able to lift heavy and do ab work and back to the gym is like 4 to 6 weeks. But the total
So
time for it's going to take you to get back to work will be 2 weeks or whenever you fill up to it. So it's a very difficult question. People are like, I don't say like, oh yeah, 6 to 8 weeks, because yeah, 6 to 8 weeks before you can, possibly lift heavy. But
right.
you should be able to do your normal thing as long as that incision is small and low. You should be able to do that within 2 weeks.
So you can't get pregnant? I thought you can't. Like if I wanted to
No,
try to get
you
pregnant, I
can't
can't.
win. No, that's not what I said.
I don't
No,
know. I
that's
didn't
not what I
know
said.
that. Like, because
No,
I
I'm
heard
saying
back
I'm
in the
saying
days.
no. That's not talking about back in the
All
days. Just for
right.
what you have. The whole reason why I'm doing it
Mhm.
is so you can get pregnant, right? So it's not to say you can't get pregnant.
Right.
I'm saying you have a 6-month window for your uterus to heal before you can get pregnant. So you have
Okay.
to let that uterus heal for 6 entire complete months before you can even attempt pregnancy.
What about like you said, going to the gym? Because I do Pilates, and
That's fine.
I think it works. Actually, while why I have my tumor, I feel like it like helps with my uncomfortableness. I don't know,
Yeah.
but that's just how I
You
feel.
stretching, you moving, you absolutely. I would agree that it probably does. But yeah, as long as you're not doing, it's just putting pressure down into the pelvis. You can do Pilates as long as you're not lifting heavy, as long as you're not doing a lot of ab work, right? But if it's just aerobic or stretching or bending and those things, you can do perfectly fine. That's fine within about 2 weeks or so. But just no straining on that incision.
Okay. Well, thank you so much. I I think I'm gonna book a consultation with you. I'm about to actually like look into it now.
That's fine. No problem. I'm here for you. Just let me know how I can help,
All right.
okay?
Thank you
All
for
right.
your time.
No problem.
All right. So how you looking on time? Because I do got some questions for Danielle, and if she's still here.
Where's she at? Hold up. Let me try to. Is she in there? Hold up.
Uh,
We should have been had. Hold up. Invite her. I thought I forgot that she was in here. I just invited her.
okay.
My bad. Danielle. Hey,
Hey,
what's
I'm still
what's
here.
happening?
I'm good. I'm like tired, but I'm
Oh,
good.
we kept they be wanting to do their consultation, so I be trying to give it to them.
No, I understand. Y'all need the help. I'm good. I'm good over
You
here
good? You
where I'm
good? You
at.
like we finally?
I'm like jumping around. Doc T done hooked me up.
Yeah,
But you
I
know,
know.
I'm good.
That's
I'm
why she's like,
good.
let them have them because
Right. Let him
No,
have the
I am
big
good,
fibroids. I'm
good.
chilling.
yeah, no, I'm
Yeah.
good. Yeah. No, y'all, I don't need to talk. Like, but if y'all have questions, I could chime in. Anybody want to hear about the experience or whatever too.
Yeah,
My case is a little bit different, y'all, so I don't know.
yeah.
Oh,
So some of these questions you probably did answer. So I'm gonna just be honest. Our audience sometimes it does ask the
yeah,
same
It's
thing
redundant.
because
that's
well
fine.
there was audio issues a little bit, and then some people don't rewatch it, so they got the same question that was answered. So
That's
we
fine.
just start over. If they hear tonight, they can hear.
Okay.
So first question: what was the measurement of your fibroids? We know how much they weigh. I don't
Oh
know
wow.
if
Um,
you know or Dr. P know.
well, Doc P, I'm not sure if you know, but I
Measure,
think
measure,
from what I read,
measurement.
centimeters.
What is it?
Centimeters?
Yeah, I guess meters. It just says measurement.
So there's all right. So measurement. So
Mhm.
ultrasounds, MRIs have a limit, right?
Mm-hmm.
They have a limit, and I honestly don't know the what that limit is, but from my experience, what I see that limit usually is around 26 centimeters. That's about the highest number. Is usually 26 or 27 centimeters is the limit. She definitely had a larger than 26 centimeter fibroid.
Yeah,
1,000%. She was in a neighborhood of I would say uh at minimum at minimum 80 centimeters and above. So it was one
really?
dominant fiber. Yeah,
It
absolutely.
was that, it was
Absolutely.
like 80? Hmm.
It has to be. So
No.
this is 10, right?
Yeah, you
Don't
might
let
be
him
right.
This
bring
is 10.
out the laptop because
This is
he good for that.
this is 10. Let's just keep this individual. This is 10. So 8 of these is not enough for you.
Come on. It was like
Come
12
yeah,
inches.
yeah.
Like the
Boy,
whole, I know it was my
well,
whole abdomen.
when we think back and be like, ah, what? No, ma'am.
No, it was, yeah, it
Right. When
was,
you got
Ma'am,
to
it
tell
was,
him
I'm gonna
and
say
he done
say
done the
like,
surgery, he like, no.
yeah, no, he would
I was
know.
like,
Yeah, I'm not gonna argue. Yeah,
listen,
no, but
I'm
it definitely, yeah,
I cut that
it
thing.
was
Yeah.
it it was a sight to behold. I wasn't awake, but seeing the video, you all, Dr. P, And that's like he said, I'm glad that I caught you at this point in your career. I don't know how long he can keep doing that because there's so much physicality to the surgery. So that's why I'm like, women, y'all, yeah, you know, get yourself taken care of. Definitely, I would say, because mine was really big. Try to get those things taken care of as soon as possible. Sometimes, like for me, what happened initially, oh, just watch and wait, but then it just grew drastically. So that's where it just got out of control.
So
So.
that's another question that is on here. How long did you have fibroids, and how long did it take to grow that size?
Well, in total, I had fibroids, maybe about 12 years in total. But when it did a massive growth, it was probably between a 6 to 8 month period. Like they were growing slowly over time, but it was
Hmm.
about a 6 to 8 month period. May I don't know. I don't even think it was a year actually, just the way that it was so pronounced where I went from no stomach to people saying that are asking, are you pregnant? It was about a 6 to 8 month period and it grew drastically. And then I kind of, that's where it's just got stuck
And
there.
and and to chime in, like the thing that aggravate it, and I try not to get aggravated because some of y'all don't mean harm with it, and I even have family members that ask this stuff too. But it's really insensitive when you guys say like, "How did she let it get that big?" Or "How did it happen
Oh,
like that?" Like how in the world is like that? That agitates me, and I know it's agitating for her and women that have to go through it because the only difference between a woman with advanced fibroid disease and just a woman with fibroids or a woman without fibroids is that they experience something, they have a rapid growth of a benign mass. And before you look up, it's that way. And it happens very quickly, but to the point of, well, why don't you do anything about it? If you go to somebody and they tell you that they're going to cut you from your privates to your chest, you're not going to allow them to do that. If you go to somebody recommend you haven't had children before. If you go to someone and is putting your everything that you want for your life at risk and everything that you really, idealize as far as like who you are and as a person, like that's not something you just sign up for. You're not going to just sign up to somebody saying something that doesn't make sense for you. No matter what's going on, you want to find somebody that you feel very confident in. And what I'm trying to tell y'all, and when people like, you got a recommendation, you got this or whatever, they not out here. The whole reason I went viral and telling y'all like, hey, like pick the doctor that makes sense, male, woman, transgender, I don't give a damn what they are, black, white, whoever they are. Find the comfortable person that you have comfort with and put your trust in them. And it's just not a lot of people that you're going to find that way. And if you go to doctor to doctor to doctor, and that's what you're hearing, the fibroid growth ain't stopping. It's going to keep doing this while you're trying to find this person. So all of that happens to a person. It's insensitive to be like, how does it happen? I'm telling you how it happens, and don't like point your finger at somebody because it could easily happen to you. Like people ask all the time, we're like, well, how does it get that big or whatever? 80% of women, 80% of y'all out there have fibroids, right? For advanced fibroid disease women, the women that have growth, it happens really quick. Why it happens like that, I don't know. There's some women that can have a 2 centimeter fibroid and it stays like that for 20 years. There's some women that can go to the doctor, get an ultrasound, and have a 2 centimeter fibroid, and in 2 years it's 20. Why that happens, no one knows. However, it's insensitive to blame her for doing that and then not doing something about it. It's absolutely crazy. So before you guys like start saying this stuff, you really have to understand the person that has to deal with it, right? And what they're going through and understanding that it's not their fault. Like stop shaming people because it's crazy that y'all do that.
Oh,
Sorry,
and I just
I
wanted
had
to
to edit
add,
it
I
out.
know, yeah, and just to add, because you all just don't know, I know at this point, I don't take it as personally because they
Yeah,
don't know my story, but
yeah,
it wasn't like I wasn't doing anything. Dr. P was doctor number 10. I was going to large institutions here in Philadelphia. I went to Johns Hopkins. I even went to Maryland, as in I was trying. I
yeah.
just didn't want that vertical cut with a
And you should.
hysterectomy, and I never had kids before. So I was fighting for my life, and I was going to do things on my terms.
Facts.
And I'm
You should.
so glad that I found Dr. P, because I can't imagine, it wasn't, I got back to daily life, but I cannot imagine having that vertical cut.
Right.
It,
Yeah.
yeah,
You still will be trying to recover from that. You will
yes.
still be recovering for that. So all the struggle that I had to do to get the thing out of there through that incision, well worth it. Well worth it to see you at this state right now and happy and not in pain and not in
No,
infections and all that stuff.
yeah.
It's worth my time and my
And,
effort.
and
I'm
it's
I'm grateful for it.
crazy. And it's crazy because I saw my primary care doctor today. This man never smiles at me. He was able to
Hmm.
see your post-op note in the
Hmm.
medical chart, but
Yeah.
he smiled so hard. It was like, I'm so happy for you, Danielle, because
Yeah.
I've been going to him like 10 years.
Yeah. I
But
know. He was
that's
like,
where,
"What the
yeah, and
fuck?"
it was amazing because he saw the cut in live person. No,
Yeah.
it was a crazy appointment, but he was wow. He was wild.
Yeah.
So
So speaking of kids, someone asked, are you able to have kids now, or how long is your wait?
Well, I'm a little bit different, but I could have kids. I still have my uterus, you all.
yeah,
Okay.
That
she still has a uterus, and to the crazy part, and that's how fibroids are crazy because, like I was telling y'all, like
hmm
that fibroid was, like I was telling you, was pedunculated, meaning it was completely stalked off the uterus. I didn't have to cut into her uterus to get it. I just had to control the blood supply and then get it
Yes.
out. So, in all actuality, if she wanted to have a vaginal delivery,
hmm
believe it or not, I would sign off for her to get a vaginal delivery. It's not a risk for her doing that. So
Yes.
it definitely has some of its highlights and benefits for her, but she most certainly has the
Yes.
equipment to be able to get pregnant.
So another,
Yes, and everything is still working. I'm
Yeah.
like, yes, ladies, I just had my menstrual. We good. I was
Yeah.
like, she's still here. Yeah,
Yeah.
I know for sure.
so another question says, do
Yes,
you have
ma'am.
to take birth control during the healing to make sure you don't have any accidental pregnancy?
Well,
I put the fear of God on her, and I said, we
yeah,
grown. Yes, I said we grown.
That was birth
yeah,
control.
Don't. Hey, look. I said, hey, look. Hey, y'all hear me good
yeah.
out your good head. All y'all, fuck around, find out.
hmm
Okay. All right. So
Yeah,
that's why I say either if you ask me for birth control, I'll put you on birth control. But if you say you're a grown woman and you know how to not get pregnant, I'm taking you as your word as you being a grown woman, not get pregnant. But don't fuck around, find out.
yeah.
Do not get pregnant within 6 months, and that's it.
Mhm.
However you want to do it. Ain't no oops, oh damn, we got drunk. I'm not trying to hear none of that shit. Just you are playing around with
Yeah,
fire.
with
Don't fuck
your life.
around.
Mm-hmm.
Right. Don't fuck around. And all this hard work, you ruin it, and you put your life at risk just because you felt like doing something you didn't have no business. Just don't get pregnant. Period.
Yes.
Yeah, that was the list I got so far. That don't mean they won't ask me something else.
Yeah.
Or they won't hear this and they'll say, could you ask her? But I wanted to make sure you came on tonight because definitely people sent some questions for you specifically, or like I said, they said whoever can answer them. So I said, well, I will try to coordinate it. I was the producer today. I said, let me coordinate who coming, who gonna join, all of that.
Mhm.
Yeah.
Yeah, so no, yeah, Dr. P. Cola and I have been going back and forth, over
It's dope.
DM. Yes.
Y'all,
So,
y'all are two of my standouts. Like I got just a few cases that just push me to my limits. Both of y'all, take a bow.
I don't know if I can take a bow because it was crazy. I don't know.
I'm
That was
proud.
Tell me
I'm
about it.
taking a bow because I'm proud.
Yeah,
Because
I'm
I got
proud.
my life back.
yes.
And
No,
you
that's
helped
the
me
truth.
get my life back. Because,
Ooh.
boy, like,
Listen, wait till I put this one out from last week. Oh my God.
Mm.
Oh man. Oh man. It was something. But I'm gonna put it out so people can see it. She's gonna talk about it. Well, I actually talked to her yesterday. Had her post op yesterday. Um, but it was wild. It was really, really wild. Like I legit probably had to put about 600 or 700 stitches in her uterus.
Oof.
It was that damaged. I saved it though. I
Yeah.
saved it, but it was tough. Y'all gonna see it. I'm gonna post it.
that's
Oof.
no.
But yeah,
I
you're a miracle worker.
can't say nothing but appreciation because it feels so different to have all your life back. It just feels it. I don't even know how to put it in words. Like especially people that knew me before and see me now. Like I said, I literally feel like I look different, and I don't mean physically in my stomach area. I mean like
Mm,
I look different. Yeah,
Physically, yeah.
I feel like I look different.
Cola,
It
I know
say it
exactly
say
what
that
you
I'll say
mean.
yes, yes, say yes.
Yeah, yeah.
Yeah, y'all the glow
The
is
glow.
different. Y'all like
Yes.
That's
It's
yeah,
your
y'all
right.
face.
like
The
Yes.
glow
y'all
is
like y'all like
different.
Last Dragon when Bruce Leroy start glowing and shit after
No, that literally did happen
Facts.
for real. I
It's true.
understand, Cola. It really does happen because it takes over your life. I know for me, I don't even know how I was doing it. I literally, when I got out the hospital, I really felt literally like I was walking on air. Like no jokes aside, like I really felt like I was walking on air because I was carrying around 20 pounds
Yeah,
extra.
like I see pictures of myself where even if I was smiling, it's not the same smile that I smile now. Like it was still a
Hmm.
sadness behind that smile.
Hmm.
Especially, I can tell the ones where oh she was on her cycle there, she was on like because it was
Hmm.
so I can see it. That's why I say like literally I look different. It really is a difference.
So somebody asked about in-state or out-of-state. I'm gonna say this again. And so Danielle is the poster child for never saying no or taking no for an answer. So this woman not only
Yes.
found me and we had the conversation, because she went through so many doctors and that told her that she made a personal trip before surgery to fly out here from VA, from Virginia,
No, from
to
Pennsylvania. I'm
from
from
Pennsylvania. I'm
PA.
sorry. I'm sorry. I'm sorry.
I'm from
I'm sorry.
PA
PA.
all
Excuse
day,
me. I'm
every
sorry. I'm
day.
sorry. I'm sorry. Sorry. PA. I'm sorry. PA. Because I'm thinking because you was like I went to Maryland and all that stuff. I'm
Yeah.
sorry.
No,
She's from
I'm
PA.
from
She's
Philly.
from Philly. She's from
Yeah.
Philly. I'm sorry. Yeah, I know
That.
that was Freudian slip. So she flew out from Philly to come out because I talk a lot of shit, but
Yup.
she wanted to say, "Are you sure, nigga?
No,
This is me. I want to meet you beforehand. I want you to see me
no.
in person to talk that shit to my face and see if you could do it." So to her credit, she came out here beforehand, and I was like, "I could do it. It's impressive, but I would do it." She went back. When she went back, the fibroid was so large that it
Hmm.
was sitting on the large vein in her body called the inferior vena cava. It was sitting on that, and it was causing fluid to come out of that
Hmm.
vein,
Yeah.
which filled up the right side of her lung and filled up her belly. So she had to get she had to get her lung drained 6 times
Hmm.
over the course of a year.
Hmm.
And then when it was finally time for surgery, her right lung was damn near completely filled with fluid again, and they had
Hmm.
to drain it. And they told her, you cannot fly, you
Yup.
cannot do anything or whatever. She said, "Damn that." She got in.
Hmm.
She canceled her flight. She got in a car, drove here for surgery. When she got here, the fluid that they took out from Philly had reaccumulated
Yup.
back in her lungs. So then I had to fight to get her on. So
Yep.
when the fluid came back, I'm like, they told me like, all right, fluid's back in here. What are we gonna do? That was Monday. I got her into the hospital, and then I tried to get doctors to try to drain it. They didn't want to do it. So
Yep.
then I finally got them to do it on that Tuesday. They drained 2 liters out of her lungs, 2 whole liters. Got the pictures to show it. Literally a liter like this,
Yep.
right? Or two. Yeah,
Yeah.
they did one of these big things.
Yeah.
What she told in the bag. They did one of these, and so they did that. And then they put a chest tube in. That chest tube had another liter come out of it. And then I finally got everybody on board to finally do her surgery 2 days later after that. So when people say, "Oh, it's you too far," or whatever, trust me, I am not waving pom poms and doing jumping jacks. Say, come see me, come do these surgeries. I'm not really. I promise you, I'm not. I am literally here as a vessel to do the right thing for women that are in this situation. That's it. Because I personally am at a point where I just cannot take botched surgeries, Black women going through crazy, ridiculous, stupid surgeries. I can't take it. And I can't, it's oh so much I can say for my part. I don't have 1 million followers. I don't have 2 million followers to say it's some quack ass doctors out here. It's some doctors that shouldn't be operating, that shouldn't be touching Black women. I could say it oh so much, but the couple thousand people that listen to me are not going to be voices for the millions. So I'm just here as the answer to women that need me. So I don't have the answers to say, hey, it's somebody over there that could take care of that 20-pound fibroid, because there isn't, right? If there was, I would send you to them. At a certain point, when you have advanced fibroid disease, when it's advanced, the comfort level is over with. They're not going to touch you. They're not going to do that. And if they do, it's a vertical incision hysterectomy. They'll send you to GYN oncology. And if somebody sends you to GYN oncology, they are telling you have to have a hysterectomy. They are not playing with you. They are not saving uteruses. They're not doing myomectomy. They're not doing it. That means everybody's throwing in the towel on you, and you are going to get a vertical incision hysterectomy. That's what's going to happen to you. So I am here for that. So everybody say, oh, it's too far, or I can't fly there, or whatever. This woman is a poster child for not today, right? Meaning she took control over what the hell she wanted to do in her body, whatever, and she just made it happen. Because I say this all the time, it's like if women all over this country are flying everywhere to South America, to Caribbeans or whatever, to get fat transferred or whatever. They're doing it. Like, you figure that shit out. You will figure out the money, the time, whatever, and go over there to do that. If that's the case, figure this shit out. If you got advanced fibroid disease, like, figure it out. Like, get here so I can help you. And if not, if there is somebody, if it's not horrible, like, there are other people that could do it, but just find somebody to do it. But don't be like, oh, well, I can't go here, I can't fly there, whatever. Don't let people butcher on you. Don't let people do things that you know are wrong to you just because you don't want to do the work to try to figure out better answers for yourself. That's my soapbox. I'm done. I'm not gonna say that again, but I just thought that I had to say that.
No, I think that was excellent. I think that was a good point. You have to advocate for yourself, and I think that was one thing I liked about the story. And one thing I really like about the story is how you talked about how you had to advocate for her in the hospital, because that
Yeah.
happens too. I have definitely been in a situation where if you have a good doctor and a doctor that you trust, usually you can count on them when you can't speak up for yourself.
Yeah.
And
I
that's
got an anesthesiologist that's in there that tried to block everything right now. I'll talk to her to this day from her case. I was like, don't talk to me. Like, you tried to block this whole thing. Like, don't need to talk to me. I don't talk to. She don't really understand why, but I know what she tried to do to sabotage it. So I'm just like, nah, we not cool. You know what I mean? Because it's like at a certain point, it's like we're going to be uncomfortable. What is her alternative? You're telling us that we can't do her surgery, you can't do that. What are you telling her with her life? Like, fuck her life? Like, what is she like? like, come on, man. Like, it's just like people lose the humanity of people and helping people, and that really bothers me. That really bothers me when you don't step out your soul for a second to just like put yourself in somebody else's shoes and try to help them, and it's like, you wouldn't want nobody doing that to your mama. You wouldn't want
Exactly.
nobody doing that to anybody in your family. And if you don't want that, then don't do that to
Somebody
somebody
else.
else. Shit is crazy. But these people crazy.
They
These
handle
doctors crazy out here. I'm
all
trying
that.
to tell y'all.
All the, like
Mhm.
I definitely been in that situation. That's why I said like when you find somebody you can trust, like we talked about, and I was like, I know I could trust you. It's so important because I've been in that situation when I was delivering my daughter. My doctor had to get on the nurses bad because they was running amok, and she was like, "Wait a minute, did my patient just say?" She was clowning, like that it happened. So I salute that. Like I love to hear that, and I love other people to hear that you have to find somebody you trust because he don't just work by himself, and he gonna have to advocate for you sometimes too, or
Absolutely.
she, or like whoever you pick, they may have to speak on your behalf. So you got to be able to trust them. Well,
Yes,
I know,
thank you, Dr. P.
right. I know we had a
You're
long
welcome, baby.
live
You're
tonight.
welcome.
I know we had a lot of questions. I think most of them I got in the bubble, but I'm gonna go ahead and screenshot. So of course we definitely are saving the live, and yes, we definitely plan to return. Hopefully not as long in between this time, but it has been a very, 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 very busy month for me and Doc P.
Too. Jesus.
So us trying to coordinate was just chasing each other. So that's all. But we're not gonna go away.
Yes.
Like I
Yeah.
said, as
Whoever's
long
trying
as
to
people
request to join, like it's just spinning for whatever reason. Like Instagram doing something crazy. I know it's another couple people trying to join, um, but it's not letting me see who that was trying to join. So we may have to let you in next time.
okay. I was gonna say I got all the questions screenshotted. So but thank you, Danielle. Like I said, this may not be the only time I have questions for you, but if you was available, I was so glad that you was able to join.
Oh, no worries.
I'm
I'm just
glad you.
joking.
I'm glad you figured this thing. Look at you. Look at the little social media expert now.
Yeah, no, I just gotta just do it. It's like, but I'm like, why can't I just do it on my computer? I'm like,
No,
Instagram.
no.
Yeah, like, cause my phone to be dying sometimes. I don't be forgetting to charge it.
Well, Dr. T taught me Instagram too. And my teenagers well, they not teenagers. I still look at them like that, but my young adults
Yeah,
help me over the threshold as well. I was like, see, training me, so they put
yeah.
me in homework. They had all my homework with me.
No worries. Yeah, yeah. Woo. But as always,
Thank you,
if
Danielle.
there's any questions, y'all let me
All
know.
right.
Thank you.
We appreciate you. We appreciate you.
You're
Thank you so
welcome.
much.
You're
I
All
welcome.
right.
Thank
thank
you.
everybody. Thanks for joining, everyone.
Hold on, you about to cut it off? I was just cutting off. You about
I
to cut
didn't
it
know
off?
it was 6:38, so
Yeah. I was trying to see if it was
yeah.
anybody else that did you we could do like two more questions. We could do two more questions and then wrap it up. But I don't these requests to join just it still is just spinning. So my apologies to whoever tried to request to join. It's just not doing it. It's Instagram is me on something right now.
Um, what are your thoughts on having a tummy tuck immediately after a hysterectomy, like the very same day?
No, no. So I personally would not do that. Um, y- you gotta be very careful, and I know the convenience of doing that. Um, the convenience of doing that is something that people will want, but my fear for that is the risk of infection because you're going in two totally different systems. When you do a tummy tuck, you're not going inside the abdomen, right? You're just pulling down the skin and all the fat that's on the top surface. When you do a myomectomy, you're actually going into the
Well,
abdomen,
they say
meaning that, say it again.
They said hysterectomy.
Hysterectomy and same thing.
Okay.
Hysterectomy, myomectomy. I'm going into the abdomen. I'm all of the parts, your bowels, your bladder, the stuff that's inside your body. We're dealing with that part. So then that's extensive. And then now the dirty part where your skin and everything, now we have to do extensive surgery on that part. Mixing them two can be disastrous. It can turn out well, but it can also, you know, be an issue with, horrible infection as well too. So I personally, if it's my mom and my sister, I would say no. But if somebody wants to do it, somebody, you had somebody in there, the risk or whatever associated with it, that's fine. But I think it's just really risky to do that. The question used to get posed to me as far as like doing tummy tucks with C-sections and stuff. I say the same thing. I used to be ambitious when I first started medical school. Like, yeah, I'm gonna get in there. I'm gonna do tummy tucks, and I'm gonna figure it out. And like figure out like mommy makeovers after C-section or whatever. And then the more I started learning and studying, I was like, yo, that don't make no damn sense, man. It's not practical. It's what you want, but it's not what you need. You want to look at the risk versus benefit for everything you're trying to do. It's just too risky.
Okay. What do your hemoglobin levels need to be in order to have a safe surgery?
I mean, there's really not a true level that it's safe. You can lose blood at any point, but you want your blood level to be higher. Um, if it's below 8 and you're having a myomectomy surgery, that's caution for concern. Your risk of blood transfusion is going to be much higher. Your risk for blood transfusion for a myomectomy is high anyway, no matter where you're at, because you're dealing with a very bloody organ with your uterus, and all of those fibroids have blood supply. So, the higher you are, the less likely the chances of you needing a transfusion. The lower you are, not only can you need a transfusion, but you can get dangerously sick too. So usually about 8 is where you're at before they, recommend starting to, give a transfusion preoperatively. Um, but definitely, like once you get down to 6 or what have you, you're trying to do a myomectomy, you're gonna need a transfusion before going into surgery. So, and all answer to that question is there's no true answer, but there's some ranges that make it uh, very concerning about performing that surgery at that level without making it go up some.
All right, you want me to take another one, or that's your two?
Yeah, you could do the one
Okay.
more last one.
Hi, doctor. I am 50 and I have several fibroids. I'm waiting for a hysterectomy, but I'm scared. I am anemic. I have tried Zoladex, and in March I had a Lupron injection that was good
Jeez.
for 3 months. Will the fibroids shrink? Even I had a short period last week.
Um, don't from a shrinking standpoint of fibroids, don't really necessarily anticipate um menopause to really save you from a size perspective. They're going to lose some size, but it's not going to be significant. For instance, if you got a 20 centimeter fibroid and you are 50 years old, don't expect it to be a 5 centimeter fibroid after you stop having periods. It's just not. You may lose a little bit of size, but if it's significant, it's going to be significant. So from a size perspective, don't expect, a huge change after menopause. Now, as far as bleeding is concerned, that's variable. um, Bleeding is definitely going to stop at some point. You're going to go through menopause, but menopause is not just 50 and stop. So I got patients now in their late 50s still having periods. So there's no true rhyme or reason of when that is. It's different for every single woman. So you can't just say, "Hey, I'm 49. I'm gonna stop bleeding. I don't need surgery." You might not stop bleeding until you're 54. That's another 5 years of having super heavy periods, you know, and not trying to deal with them, just waiting on menopause. So menopause can save you from bleeding, but it also can also be just like a kind of smoke and gun mirror type deal to where it's like, oh, it's coming, it's coming, it's coming, but it don't come for years and years, and you having suffering issues from it. So just be careful with menopause and a misconception of what menopause is gonna do for fibroids or bleeding.
All right, I do got one more hot topic. I forgot about
All
this. A lot of
right.
people ask, well, not necessarily say ask Doc P, but a lot of people just hit me up in general because people just talk to me now. I told you I'm your chat bot. So I don't know if you saw the headline about Holly Berry saying that her doctor told her that she had herpes
I saw that.
because of, oh, you saw it. Did
I,
you?
I saw it, but I didn't read it. I have not read into it. But go ahead. Let
No,
me
no,
go
I
ahead.
was gonna say I personally didn't get a chance to read the article, and that was
Yeah.
one of my homework assignments before production, but I didn't get to.
Hmm.
But basically, I guess from what I can understand, the Cliff Notes, and again, I didn't read it. So if somebody knows exactly what happened, definitely override what I'm gonna say. But basically, from what my understanding is, Holly Berry basically announced that she had some type of burning pain sensation in her vagina. And when she went to her doctor, they said that it was the worst case of herpes they ever saw, but her partner was not positive for herpes. She never had herpes before. And people were just saying, so she was saying she was going to use her platform to educate people on getting second opinions, I guess, or not just trusting the first thing somebody tell you, because she obviously went, like, you know me, I'm gonna say, what did you go, I'm gonna go blame the person. She did that first, and then he got tested and everything, and he didn't have it. So it was like, oh, so what you been doing? But she said it ended up being, I guess, perimenopause.
So that's the most ridiculous thing I've ever heard. Damn near like, and it's not from her perspective. It's just from whoever was taking care of her, the doctors that were taking care of her. Misinformation is so horrible. So I'm starting to piece it together because in all honesty, if I'm misspeaking, I hate speaking on
Yeah,
things that I
so
don't really know all the time.
that's a topic.
But
I,
from the
I
sounds
didn't
of it,
read
from
it.
the sounds of it, I'm gonna tell y'all what it sounds like. It sounds like she was experiencing um, something called atrophic vaginitis, meaning menopause, she starts to lose her estrogen. It causes like the tissues of the vagina to start to kind of break down and become weak or what have you. And so during sex, she's having basically sex with kind of dry, brittle tissues in her vagina, which probably cause sorry, which probably caused a significant bit of irritation. Um, and so she went to her doctor with that irritation and pain because she had these brittle tissues in her vagina. And they just said because of that pain that she had some herpes. And that's crazy. Number one, if it's herpes, you would see lesions in her vagina that you could say, hey, that it could possibly, which looks like an ulcer. They look like smaller ulcers. And if that's the case, you test it and see, even before you say it's herpes, you have to test that and see and send it off to get a diagnosis. There's blood tests in addition to that before giving that diagnosis. But I don't understand how in the world they would misdiagnose atrophic vaginitis for herpes simplex. It just doesn't make much sense, but it's to the testament of some quack ass people out here. I keep trying to tell y'all,
And she
you know,
got money. So,
yeah, listen, people can Google, they can send Google reviews and all that stuff, whatever. I just tell y'all how it is. It's some horrible ass men out here. It's some horrible ass women out here. Sex, gender has absolutely nothing to do with common sense and intelligence. It doesn't. And I don't care who you are, what field of medicine you're in or whatever, whether you're a man, you're going to a woman, or you're a female and you're looking for a gynecologic person, a gynecologic doctor, whether it be man or women. It's idiots on both sides of the fence. And when someone's telling you something that sounds stupid to you, you don't take stupidity and try to make sense out of it. If it in your gut sounds stupid, you go find someone that has common sense that will tell you something better. And don't limit that to whatever your bias is about whoever it is or whatever. At the end of the day, Your health is what matters, right? So black, white, brown, man, woman, transgender, I don't give a shit who it is. If they look out for you, they have your best interests at heart, they are knowledgeable, and you trust them, go with that. Don't listen to say, "Oh, girl, these people don't do that." Listen, don't. I 100% agree and believe that black people are in the best hands with black providers. That's true. But I also will tell you that there's some black providers that are trash, right? And there are white providers that I know and are friends with and are cool with that I would trust with my family way before some of these black providers on there. So I'm proud to be black, yes, but not at the risk of health or the well-being of myself or my family. So don't limit it to a color. I wouldn't say my mama has to go to a black provider or a black woman or a black man. I would prefer that, but the person that did my mother's surgery a few years ago was a white man. And it was somebody that I talked to extensively. Then I gained a trust in him, and there was minus his skin color, he was compassionate about not only caring for my mother, but compassionate about her son, who's very knowledgeable, and making me comfortable too about trusting him and not being an asshole. So that had no bearing of color in it. So it's be very selective about the people who you choose to be in care of your body because they are in charge of your life, especially in surgery. When you are in surgery, you are going to the world. Your belly, everything is totally open. Whoever it is that is operating on you has your life in their hands. A millimeter here, a millimeter there, a cut here, a cut there, a buzz here, whatever could be the end of your life or a severe disfigurement. So, with that being said, you need to trust that person, and it should not be limited to anything. Have full trust in who has your life in their hands, and that's all the fuck I'm gonna say about that. Y'all can take that, and whoever don't like it, you can go ahead and start the shit viral again, or fucking go Google and say he's a misogynistic, whatever the fuck you want to say. I will say that shit again. I said what I said last year, and I'm gonna say that shit again. Don't be an idiot. Like, take your life and your body in your hands and don't be biased about that. Like, be very intentional about what you're trying to do with your life and your family and everything around it. Like, they cannot do dumb shit to us no more, right? All of the stuff that medicine has done to black folks in the past or what have you, it's happened. But from here on forward, if y'all don't hear nothing else I say, educate yourself and take your health in your hands. Do not let someone tell you dumb shit or do dumb shit to you, right? Because you know better, or just because of whoever they are. Just because it's this person, it's that person. Don't do it. Because at the end of the day, something bad happens to you, nobody cares about that person. But nobody, it's done. What's done is done, right? Just be smart, people. I swear, please just be smart.
We got too much access now to
God, too much access.
too much access.
Social media is a great place if you use it appropriately.
And even sometimes, like you said, if you can't find somebody that look exactly like you, ask them what's the demographics of their patients.
Absolutely.
If they're other races, but a majority of they treat 80% of your race, they probably know what they're doing with your race. But you just got to still interview them.
Big
You
facts.
still got to interview them.
Gotta get, man. You gotta check in.
You still got.
You gotta check in. Like everybody, like you gotta check in. I'm not, man. Y'all really have to be smarter than this. Like you gotta be smarter. Like I tell y'all, use social media as your tool. Like I'm on here on purpose because everybody that says like, oh, he ain't there, he ain't there. I want my patients to be here so you can ask them. You don't have to ask me. Ask my patients. Like ask them. I can't be this black man doing all of this stuff, talking all of this stuff or whatever, and I hear butchering women. So you would air me out. All my patients would air me out. They would be on here talking crazy about me, right? And that goes for any physician. If they not, willing to like let you like their patients and they private and you can't talk to them, whatever I have nothing to hide. And you have to be really, careful about people that got stuff to hide or whatever. You can ask these questions. Don't be scared to not ask questions. Questions, questions, questions. Ask them,
Yeah.
right? Feel comfortable before you agree to do anything.
Yep.
All right, let me get off this soapbox. I'm preaching out here.
We need,
That shit, I be getting passionate about it, man. I get one more woman coming in. Oh, they hurt me. I've been in 3 surgeries. Can save me. I'm like, shit. Now I gotta fix this shit.
mm,
Golly, like man, like it's just a lot. I get somebody every week they come in like multiple surgeries. I done had a myomectomy. I don't know what to do, fix it or whatever. It's tiresome. It really it drains me to see people go through mistreatment. It's really bad, so
because you definitely care about your patients, and
I do.
you definitely care about your patients. So
I do.
that's the first step, finding somebody that care about their patients and not just care about the title, the prestige, being able to say,
Mm-mm.
like, you don't care about none of that.
I don't care about none of that shit, man.
Yeah,
I don't.
I love that.
All right.
Authenticity is very important. Well, thank you, Dr. P. Always, like I said, it won't hopefully be this long next time, but it was just
No.
madhouse.
All right, it's not. All right. So we'll at least let's make it
Yeah,
like 2 weeks. Maybe not next week,
let's
but
definitely shoot.
within 2 weeks we'll do another one.
Yep.
And y'all watch this. I'm gonna post it. So it's a lot of information in here. It's a
Yeah,
lot of questions being
definitely
answered.
gonna,
Please watch the damn things again.
definitely gonna say.
Please, people.
And I'm gonna record
Yeah.
it, put it on you. I'm gonna record you and Danielle's too to put on YouTube as
Yeah.
well. So
All right. Yeah, they didn't let us be great, but it was good information
it
in
was
there.
very good, very good. Well, thank you for all you do, and we'll talk in
All right.
2 weeks.
All right, people. Y'all be safe. Be blessed. I'll talk to y'all later.
Bye bye.